Good morning, Mr. Chair and Commissioners. Jamie's here as well to provide some information. The first document, of course, as always, is our data. And so as you look at the number of cases across Clay County, as well as across the state of Minnesota, we have 880 now positive cases in Clay County and 75,864 cases in Minnesota. The deaths in Clay County still remain at 40, so we're grateful for that. No new deaths. And then you see our 14-day case rate per 10,000 people is 7.32. And as you recall, that is a number that the K-12 schools are using, and they're just watching that. It's been under 10, so they do have the ability to do in-person if they choose to with all of their other measures. But it's 7.32, so it did decrease in a positive way since the last 14-day case rate. Minnesota has a 7-day positivity rate of 5.2%. Clay County, as we talked about last week, or the week before, is it's really hard to get a very accurate positivity rate because we're still not getting all of the test results from the North Dakota Public Health Lab. So our rate is probably around that same average is our best guess. The number of cases, and we've talked about this last week also on the second page, is going to change. So the confirmed cases of date testing, what we decided to do is change it to Wednesday, because if we see the numbers from the previous Wednesday, it gives a little bit more accurate number when it comes to giving you the results at the board meeting. So that 5 to 7 day or 3 to 5 day where they're waiting for test results had caused a lot of inaccuracies. So if we give you Wednesday, so you notice the dates have changed. So if we give you the Wednesday dates, it might be a bit more accurate for the test results. So that's why the changes. So from here on out, we'll hope to have a bit more accurate count.
So Kathy, on that, if I can understand, so the numbers, for example, on August 26th now, the numbers that you have, that would include all the tests that have results, but it would not include tests that have been performed, but we haven't. And that's why, going back to my question last week, then you update those numbers after the fact, because those previous tests now have results.
Exactly.
Okay.
Yep, that's exactly.
That helps clarify that to me. I found it kind of amazing that we've had different.
Yeah.
Going back, now next week you'll report back to us on August 26th, we'll have different numbers than today.
Correct, right. So that maybe will help where it's not such a large fluctuation. You're right about that. And as you probably already know, that the federal government is concerned about the high level of community spread, both in Minnesota and in North Dakota. We're two of the states that are not decreasing. We've seen some increases. There's some reasons for that. We do know that when we had all of the higher ed students come back, we may see some increases. Now in our area, what we know is we have maybe 10 or 11 cases in our higher ed campuses right now. That may change, that may increase, but you hear about in Grand Forks, UND, large numbers of cases, especially with the fraternities, and there's large numbers of cases also at NDSU. So we're seeing the numbers with the students that are socializing and not wearing masks, not social distancing, which we really expected. We were hoping that there would be really an adherence to the measures of protecting each other, but it's college, and we expected that students would they want to socialize and they're away from home, so it's kind of an expectation. But Dr. Burks was here in Fargo, and she really is concerned about the high rate of growth, and of course a lot of it is in the metro area, but the Midwest is beginning to look a little bit different than the rest of the country. So her message again is we really have this individual responsibility to wear your mask, social distance, stay home when you're sick, stay home when you're waiting for your test results, avoid crowds. So it's really about our individual responsibility. What they've noticed in our businesses where there's masking required, we are not seeing so much of a spread. So it really is kind of the social. There's been a large number of spread with people that have had weddings, in funerals. You've heard about some outbreaks. And then Sturgis, they were watching that as well. So in Minnesota, there's been 49 cases identified with the Sturgis event, and there may be more, and of course that's just in Minnesota. We'll see probably a lot more across the other states as well. So, you know, it's just to kind of remind people it's so very important to do those simple measures. And I say simple, but that's all we have until we receive the COVID vaccine, is the masking, social distancing, stay home when you're ill. Any questions about that? And North Dakota is, of course, experiencing the same thing. As she talked about, North Dakota's in a similar case as Minnesota, where we're looking at the states that are seeing some case increases. So I'll let you, go ahead.
You say Sturgis, Minnesota has 40 cases, something like that, 49?
49 cases.
49?
Mm-hmm.
Did North Dakota have anything, or South Dakota, do they have any records, or do you know?
I'm sure they do, I just don't have that information.
Very good, thank you.
Yeah, so I'll let Jamie talk about some of the other items.
Okay, a few of the highlights from this past week. One being higher ed. Our case investigation staff have been working with higher ed. One of the things that they're doing is they're being very proactive, and they're having their students fill out a self-assessment for symptoms. And then they're doing kind of almost like a precautionary, you know, just can you stay home and remote, you know, for class. And so they're being very conservative until they're able to get tested and get those test results back. So I think that's helped a lot to get those numbers down. So troubleshooting with them is a lot of what we've been doing. So not technically are they quarantined, but they're kind of being excluded or asked to be excluded, just to be cautious while they wait for their test results to come back. So that's been a good thing. Then real important thing that came out just yesterday for our K-12 and our child care is a COVID-19 decision tree. And so basically it'll help the schools to kind of sift out, like going into fall, and the common symptoms that they'll be dealing with. Instead of sending everyone home for quarantine, they're actually breaking things down to the less common symptoms and then the more common symptoms. So the more common symptoms where they would quarantine or isolate them and recommend that they be tested, both students and staff and child care providers and the child care, are like a fever that is equal to or greater than 100.4, a new onset and or worsening cough, difficulty breathing, and new loss of taste or smell. So that's the more common symptoms. What they're doing is they're looking at whether they would be evaluating them remaining in school or in the child care center with the less common symptoms. That can be a sore throat, nausea and vomiting is what they see a lot. There's a lot of GI things. Just the general fatigue, onset of headaches, kinds of things. So nasal congestion is one, the runny nose, that they'll kind of look at those and watch the symptoms more rather than an automatic exclusion. So that will be a huge tool to help them decide whether there will be a lot of people that are quarantined or not. So just came out yesterday from the Minnesota Department of Health, and trying to sift through that, and we'll be supporting the schools as they work through that process as well. Let's see, so then I'll move on to restaurants and bars. Yesterday in the media update, the Commissioner Malcolm, Commissioner of Health, talked about that they've stepped up enforcement across the state of Minnesota for just basically doing some compliance checks. They said for the most part, people, the businesses are doing a great job. They do get some reports, but it's mostly the customers that are the non-compliant. And so they did do some spot checks. They're doing them randomly, but they're also following up on where they've had repeated complaints. There are very few, but the ones that they have had cases, outbreaks associated with have been repeat offenders. So that's something that they're doing to try to support the complaints they're getting from the community. She really did stress the fact that it is the customers that are the less compliant. Then long-term care, what came out this week too is CMS, Center for Medicare and Medicaid, has some new rules they've established for long-term care facilities. So they'll be focusing on testing requirements, and the guidance is very clear. It is also based on the frequency of the county positivity rate. And so they'll also be doing compliance with them as well. So their surveys will include that. But they will too be looking at a low, medium, or high frequency for testing of their residents and their staff. A low frequency would be a positivity rate in the community of less than 5%. And so they would have to test their staff and their residents monthly. And then a high rate would be greater than 10% positivity, and they would have to do 2 times a week testing. So 2 things they'll be looking at is what do they have for cases in their residents and their staff, but then also what is the positivity rate in the community. So again, clearer guidance for long-term care in terms of how frequently they need to be doing testing. So those were some highlights from this past week that came out. Any questions?
I have just a couple short questions. So if I can go back to this document here, and whether Jamie or Kathy, the one you want to answer. So when I see the confirmed cases by date of testing, in August 19 it shows 823, and August 26 it's 866. Those are separate total amounts, am I correct? There's no carryover from the previous week in those numbers?
Those are total amounts.
Those are
correct.
total.
Total
Yep.
numbers. So the week of August 26th, there were 866 confirmed cases.
Correct.
Total.
Yep.
Okay. Going to the deaths, I see that from the first confirmed death in Clay County was on April 15th, and so April 15th through May, it looks like we had, if you count June 3rd, there's 35 cases, or 35 deaths that occurred in that month and a half time frame. And now for the last 3 months, we've had 5.
Mm-hmm.
So, I mean, that's showing, that's some encouraging news there. And I'm curious, is that because we got a handle on the cognitive care facilities? Is that where you're thinking most of that is?
Right, the majority of that was.
Are you seeing anything in terms of therapy that's helping in that regard?
The long-term care deaths initially when we started were really the
It was a
hot
real big
spots,
spike. Yeah.
really large spikes. And so as they got a handle on that, and they did come in and do testing eventually for those long-term care, and they ramped up their protocols as well. So that was the majority where we were seeing large numbers.
And it was primarily our long-term care. At that time, we had a shortage of PPE,
Yeah.
and testing was not readily available.
Well-
So that's when we started working with the Fargo-Moorhead Task Force to try to help our long-term care with testing as well.
Mm.
So things are in much better shape now than they are for both of those 2
Yeah.
things.
40 is a lot,
Right,
but
it is.
Yeah.
I think it's somewhat encouraging, though, to see that number dropping the last 3 months compared to the.
Absolutely.
Kathy, I have a question on
Yes.
the likely exposure. With us being a border city, it's difficult to maybe pinpoint that. So you have 17% of the positive cases have been because of travel outside of Minnesota. But obviously you have, community spread, 15 and 19%. There's no possible way to say if that's North Dakota community spread, or is there?
Right. They're saying that's community spread of the cases from Minnesota, but yes, whether they whether they went across the border. They're
Okay.
not distinguishing that, so.
I got one question too. Kathy, back to what Commissioner Campbell was saying about August 26th data, 866 confirmed cases. Again, how can we never see the amount of numbers of tested people that day to compare the two and the percentage of that every day? Those are two vital figures that have always been missing in this, and I don't know why.
Yeah, and we've worked really diligently on trying to get the number of testing, because again, all of our testing, the majority is done on the North Dakota side. That's where people are getting
I
tested.
don't mean locally here, I mean in the state of Minnesota.
Oh, in the state of Minnesota?
Yes, that's correct.
Total number of cases?
Number of people tested per day, and they're giving us the number of people that have tested positive, but we're not seeing the number of total tested people in Minnesota that day where that figure comes up. So we
Yeah.
don't know what the
It
actual
had-
percentage of
on
reinfection
the
is.
Yep, on the second page.
Yeah, on the second page, there's total number of tested.
On 8/23, number of completed tests
Yep.
were 287, but the number of completed tests from the external laboratories were 12,009.
Commissioner
So it gives
Haney,
you
that's
the-
on this individual page on the front.
I'm on last week's, I'm sorry.
So we have total number of completed tests, that 1,489,000, and
No,
total,
number of tests completed that day when that 866 figure comes up. How do we compare those two?
It's on this sheet.
yeah, and we have the total number of completed tests on 8/30 for 11,346. On this other sheet, this was more of the confirmed cases of testing.
Do we have that here?
Yeah, in this
The
first,
one that has Minnesota COVID-19
first
case.
page on the, right under the blue
Okay.
column.
On top. The second dark line. Is that what you're looking for? The second line?
There we go, yep. Yeah, that says on the 30th, but the figure with the 866 that I was referring to is the August 26th date, and I can't look at that and see what that percentage is.
Yeah, the 830 is actual completed tests in, that is across the state in Minnesota, and these are cases in Clay County, the 866.
Okay.
And then that's the completed, confirmed
Okay.
cases of
So
test.
the daily case for the 830 is what I'm looking for, I guess.
I think you just got weekly figures there, don't you? Or-
Yeah, you're looking for, so the 830 number of completed tests, that is across the state of Minnesota.
Yes.
And are you looking for,
How many people were found to have the COVID-19 virus and tested positive on that date compared to the 11,000 that were tested total?
yeah, and so we have the number of positive cases in Minnesota of 75,864, and the new cases of 679, but you're looking for a specific, how many tests were positive as of August 26th versus the total number of completed tests on 8/30, is that correct?
The daily number of people that are tested, or I'm sorry, the daily number of people that are found positive with the COVID-19 versus the number of total tests that day gives us a percentage of how virulent the virus is at that point in time. Okay, how many people are being infected? And has that percentage gone up? No, it has not. Has it gone down consistently since June? But that should be the first stat that we see when we look at these figures. That tells us more than anything else, that and the confirmed fatality rate, which is
Yeah.
the number of people that are infected, or the number of people that are dead divided by the number of people that are found positive. That's the case fatality rate, right?
Right, the case fatality rate, and we're looking at the case total Minnesota positive cases, and that's the numbers that have gone up significantly.
By how much?
Well, if we look at last, I don't think I have last week's. I don't think I have last week's number, but the percentage of the positive cases that went up, I'm trying to find that, sorry.
I've got a note here from the media call yesterday. The Commissioner of Health said that it was 5.2% over the 7-day positivity rate was 5.2% on August 22nd for the state of Minnesota, and the prior week had been 4.9.
Okay,
So
so
that's
0.3% difference.
right.
Right.
Okay, but is that a trend?
Well, hopefully not.
No, but I mean, how do we know? That would be, I would think that would be the most important statistic to track on a daily basis. And that should lead all other statistics. Today it's 4.9, tomorrow it's 5.0, it's going up. But instead of saying it's up, by how much, you know?
Yeah.
How do we know?
And it'll be week to week. It won't be, we'll get the positivity rate every week, not
I understand the
daily.
numbers on the weekends are always dropped off. So that's why
Right.
the
Right.
graphs go down to nothing on the weekends.
Right.
Exactly.
So their concern is just that it's going up, and we hope not to get into a situation where some of the other states were, where they continued the incline of cases.
Okay.
I think kind of what Commissioner Haney is after is, so on August 26th, we've had a total of 866 confirmed cases.
Correct.
From Clay County residents,
Correct.
right? But what we don't know is, to go along with that 866, how many Clay County residents were tested? I think that's
That's
Right.
part of it,
That's-
yes, thank you.
that's
Kevin.
part of the question, because when you get that, then you can get to these ratios, or
Right.
percentages.
Right. We're
And-
making policy decisions whether to open schools or not, based on that, on those figures, and it's not evident. We have to dig hard to find
Yeah.
those.
Well, the schools are going by their, the rates that are on, we have it on that first page. The schools are going by the 14-day case rate per 10,000 people. So that's the rate they're looking at, and we're giving that to them every week. But because we cannot get all the testing, how many people were tested, we just can't get that. I've tried over and over and over to get all of the tests that were completed, and they don't get that at MDH either, because there's not a means, or the North Dakota Public Health Lab, to get those results. So unfortunately, we don't have an accurate number, which makes you know, it's not an exact science then.
Yeah.
It's a
Kinda
less
really-
than accurate
It's kind
number.
of really unfair to Clay County, being a border
Yeah.
community, because you can get those if you're in Hennepin County.
Correct,
And you
correct,
can-
because they're
you can
getting
probably
done
get 'em
within
in-
this.
In Otter Tail County.
Yes, yes. But because so many of
You can't
our,
get them in Clay County.
yeah, so many of our citizens are being tested across the river, and
We don't know how many.
we've tried over and over and over through the task force to get the number from the public health lab, and they just don't have a means to give us those exact numbers, so it's very difficult to get a positivity rate for our county. So we do the best we can with the ones that are tested, but it's again, not an exact science for us.
And that's the one thing that Kathy keeps saying too, that even though our positivity rate is higher in Clay County, she's confident that it's not as high as that it looks like, because of the negative tests that are on the North Dakota side that we're not getting the results for.
I understand the frustration. It's frustrating not to get all the information, and we feel the same way.
I
We keep-
understand we have a higher case fatality rate here, and probably because of the large number of nursing home people that we have in Clay County.
Long-term care
Correct.
providers,
And
yep, assisted
Almost
living.
all of the people, unfortunately, that have passed away have been residents of nursing homes.
Right, exactly.
So,
Yep.
And it's nice to see so far that our higher ed is much lower, as Jamie mentioned, than some of the other areas we're seeing. So we're hoping that's not a continual trend, but yeah, I understand the frustration. It's frustrating that we don't get all of that. Any other questions?
Okay. You're done with your stuff then? Okay, let's go into your addition to the agenda, which was allocation request for community resilience based on CARES plan. You want to go into that?
Yes, and hopefully, did you receive the breakout of some of the items for, that we are requesting through the CARES Act funding, some of the public health needs. Now, we've divided it out into various areas. As we know, we're going to get the vaccine, and so we have to have the pharmaceutical grade refrigerators to keep that vaccine appropriately temped. We also will have the influenza vaccine as well, so we've requested the additional things in the public health clinic that we will need to keep that vaccine for when we either do a mass dispensing event of some sort. And so we're looking also at that under emergency preparedness. We're looking at the various items for mass dispensing. That is something that the state has requested that we plan for. We also believe that there will be the COVID vaccine through the healthcare systems as well, but we anticipate that we'll have large numbers that we need to vaccinate in our community. So we're asking for all the equipment that may include, including a drive-through tent, et cetera, which might be an ability to get a lot more people vaccinated if we can do a drive-through vaccination process. So all of those supplies under emergency preparedness are for just that, preparing for that mass dispensing. We also, under the mass immunizations, we'll have the additional things like the gloves, hand sanitizer, wipes, et cetera, to provide that mass testing for the population. Stop me if I'm going too fast. I'm not going through each line item, but if you'd like me to, I could.
Hey, those vaccines, how long do they last? I mean, you keep them in refrigeration and stuff like that. How long does a vaccine last?
They all have an expiration date on them. I don't know exactly how long each one is, but they have an expiration date. And what we do is we work with the state and then other local providers to move them. If it's moving slower for us, then we move it to a local provider who uses the MinVac and the uninsured vaccine from CDC. So we keep it moving so we don't let it outdate.
Okay.
It's probably, we're anticipating similar to our influenza vaccine. We're anticipating probably the same, which is a pretty long refrigeration life.
Okay.
We also are anticipating that the vaccine for COVID will be a 2-dose is what they're anticipating. So an initial dose and then a booster dose. So that's kind of the plan at this point. So maybe a 2-dose. There's nothing firm, but that's just kind of the anticipation. So get your influenza shot, and then you'll be ready to get your coronavirus shot whenever that becomes available.
You wouldn't have any information yet how far apart they would be, would they? I mean, you say a 2-dose, you don't take both doses at the same time, do you?
Correct.
I believe it's 30 days.
Pardon?
I believe it's 30 days, but I'm not positive about that. I'll find out.
Okay.
Typically, it's a 30-day spread for a booster dose of any type. Sometimes it's a 60-day spread, so we'll find more information out about that.
Okay.
And our detox has, of course, quite some high needs because of the inability to social distance, difficulty keeping masks on clients that come in. All the staff are wearing masks, but just, and we've talked about this before, the facility isn't conducive to being able to keep people separated. But we have a number of needs in there that we've, because of COVID, that we put down short of, moving out of that space or a remodel. So some of these are just the ability to work with clients through this pandemic, where we included a fridge, nightstands, portable blood pressure machine so we can go around and take blood pressures versus having them all come into the nurse's station, and then some individual care items. And then we also have possibility to get a transport vehicle. We do not have one. We have in the past asked the juvenile detention center to be able to utilize that, but sometimes there's clients, they can't take the bus, they can't take a cab, and they aren't, it's not a qualified FM ambulance ride. So if we can find a vehicle that is not too expensive, that we could provide transportation for some of these clients, so many are homeless as well. We have that in our request. And then, of course, we do a lot of mailings under Healthy Communities, Healthy Behaviors. With WIC, our family health program, we're not seeing people face-to-face, so there's a lot more virtual work. We also have a baby scale we've talked about with the nurses. So if somebody is in really high need of weighing a baby for failure to thrive, we need to keep a scale in someone's home for a period of time since we can't go in and out. So we would like an extra baby scale, and if we need another one, we can do that as well, to ensure that we can get accurate weights. The parents can weigh the babies and then report back to us. So we have a number of needs there as well. We also will be doing outdoor visits with some of our families, because we really want to have eyes on the family and on the baby. So we've got some equipment for outdoor visits when we can, before the snow flies, so we can see some of those families directly in person. And then some of the other expenses, just more costs with, because we're remote, with mailings and some of our travel expenses and postage. So our grand total is that $339,261 out of the CARES funding for our public health needs at this time. So because I didn't go through the details, do you have questions about some of those items? Or?
Mr. Chair, I think on behalf of our committee, in some ways, we apologize for having $339,000 brought to you on a agenda addition item. We kind of went through, and these are numbers that our COVID committee agreed to just finally yesterday. And we felt it was extremely important to get it in now and to get approval from the board now. As we know and we've heard in past, when you get into necessity items, sometimes you have to wait. There can be back orders, and we don't want to have that problem here if we can help it. So that's kind of the reason why we brought this to you today rather than waiting till next week, because we want them to be able to start ordering these things ASAP to make sure that they're on hand when we need them. So. But this did get the recommendation from the full committee, these items. There's obviously many more from public health that we have put on a back burner right now to get more information on. But.
Well, I'd have to agree. I mean, we're talking about COVID-related funds, and this is COVID-related. I mean, this is where it all starts. Yeah, I mean, these are funds used for COVID. We wouldn't be doing this otherwise. So.
Correct.
So these are really necessary items for COVID. So.
And I would like to add later in our agenda, when Darren and Steve come up, we'll be giving you some graphical information that shows the 6 pods, what we originally put in each of them, and how much we've have approved spent to date. And I think you have something that shows what it will look like after today's approval. So I think you'll get a good idea of where we are in all of those categories, but in our later presentation.
Okay.
So with that, Mr. Chair, I would move that we approve today's recommendations from the public health pot of CARES dollars, totaling the $339,261.
Second the motion.
Okay, we've got a motion by Kevin, second by Jenny to approve the funds for COVID-related public health. Any further discussion? All in favor?
Aye.
Opposed? Motion passes.
Okay, thank you, and we'll certainly let the county know when we will be starting influenza vaccines. We anticipate maybe earlier than last year, so September. So we'll be trying to get those out as soon as we get the vaccine in. So we'll alert you on that.
Okay, thank you.
Okay, thank you.
And thank you for your 20 years of service.
Thank you for having me.